Hello, it's Friday, June 1st, and it must be time for another legislative update from your North Carolina Medical Society. Had a busy week. It was a holiday week, but you wouldn't have known it by all the activity, the flurry of activity down at the General Assembly this week. I want to update you on the budget. We mentioned that last week in the process that was going to be occurring this week. I want to update you on some healthcare bills that moved this week. Update you on the HOPE Act, which is a brand new opioid bill that's emerging out of this session, and then finally wrap up with some activity in White Coat Wednesday. We are working on the budget this week. We saw it and passed it. So we now have the second year of the biennium. The 2018 budget year has been completed or completely approved. So any updates that were necessary have been done this week. This is the fastest we've ever seen a budget. They worked on this for weeks and weeks behind closed doors, but this is the fastest we've seen it as a public process. It was done as a conference report this year, which means that it emerges as a single document and you can only vote up or down on it. So there were not a lot of amendments this time, as we've reported to you in the past. There weren't a lot of committee meetings about this where a lot of changes were made. So it's just a straight budget. You can go online to our legislative blog and see all the pieces that are in there. One piece that I would highlight for you is the new birth screening or screening at birth tests that were added to the budget this year. 3 new tests that really formed out a more robust test for newborns. We're very happy to see that included as a part of this year's budget. That's something that is usually covered by insurance or Medicaid, but we think that's going to lead to a significant improvement in identifying health issues for newborns at an earlier point. So we're excited to see that that was recognized by the General Assembly and included in this year's budget. If you want to see the other adjustments and new things that were added in, like I said, go to the legislative blog. Also on the legislative blog are a number of bills around intellectual and developmental disorder that were passed in the House Health Committee this week, as well as a bunch of bills that were introduced this week regarding health care, whether it's birth center licensure or any number of things that was introduced both in the House and Senate. So you can see all of those summaries on the legislative blog right now. Remember, those summaries are super short. This is not legislative language. This is 1, 2, or 3 paragraphs, so you can understand exactly what people are introducing and talking about. One bill that was introduced this week but is not seen a committee meeting yet is the HOPE Act. This is going to be Senate Bill 616. It's the Heroin and Opioid Prevention and Enforcement Act. This act really focuses more on law enforcement and their accessibility to the controlled substance reporting system for investigating active investigations around opioid abuse. But it also includes a whole myriad of other provisions that would affect your life and the way you interact with your patients and the way law enforcement interacts with you in regards to the prescribing and tracking of opioids. This is kind of an extension of the STOP Act that occurred last year. It has been a partnership with the AG's office, but it's been led by the same folks, those familiar faces. Representative Murphy, our only physician in the legislature, Representative Horn, Senator McGinnis, and Senator Davis have all been a part of authoring this. We really appreciate all of the latitude that Davis, McGinnis, Dr. Murphy, and Horn have provided for us this week, because they've been very good at working through concerns as those have emerged even before the bill got a committee hearing, to make sure that you are protected, that your patients are protected, that folks are not coming after you or getting information about you and your habits in any kind of way that you need to worry about, but so that we are also not obstructing law enforcement from doing their job. And so we really appreciate all their support. That bill is probably going to emerge next week, so be looking on the website for more information about the details of that bill, but then also when it will probably be heard. I think it's going to be in both House Health Committee and Judiciary 1 Committee, because it's adding in some new criminal offenses as well. So in summary, lots to look at on the blog this week of both things that have passed, things that have been introduced, and things that are likely to be big issues by the end of session. So go there and make sure you're checking out those summaries. The final thing I'll wrap up with is our White Coat Wednesday. We've had an incredible series of White Coat Wednesdays this year, and this one was even better than we've had the last couple weeks. This included OBGYNs, pediatricians, some of our leadership scholars, and our physician assistants all joined in. We had more than 80 white coats walking around the building this week, and it was a great presence on a busy Wednesday down at the General Assembly. I hope that if you have not yet been a part of one, you can try to come next week as we are still in session. And again, like I've mentioned to you before, if you can't plan to be there these next couple of weeks as we're wrapping up session, go ahead and look to your calendar beginning the middle of January and February all the way through June or July of next year, and find a Wednesday that you can come to town. It doesn't matter the Wednesday. It doesn't matter your specialty. We just want you to come into town and be a part of the process of talking to your legislators and advocating on behalf of your profession and your patients. So until then, until next week when we have another update, I hope you will go back to the blog and see the details. Contact us with any questions or concerns that you have so that we can relay those as a part of the conversations we're having on your behalf. Have a great weekend.